Here's something the insurance industry doesn't want you to figure out on your own. Medicare is not complicated. It was just made to feel that way. There are 4 parts, A, B, C, and D. Each one covers something specific. The rules are actually pretty straightforward once somebody removes all the jargon and just talks to you like a human being. I'm going to do that today. In about 12 minutes, you're going to understand Medicare better than most 65-year-olds who've already signed up for it. Let's go. Here's what actually happens when most people turn 64. The Medicare mailings start. There are dozens of them. Each one looks official. Each one uses a slightly different set of terms. Original Medicare, Medicare Advantage, supplement plans, drug formularies, IRMA surcharges. And here's the kicker. A lot of those mailings, they're from private insurance companies, not the government. They're designed to look official so that you trust them, read them, and eventually call the number at the bottom, which connects you to a sales agent who earns a commission when you sign up. I'm not saying those agents are bad people. I'm saying their incentives are not the same as yours. And the confusion, the overwhelming amount of information, that confusion is profitable. Confused people make rushed decisions. Rushed decisions often mean people end up in plans that don't cover their doctors, their prescriptions, or their actual medical needs. The penalty system makes it worse. If you miss certain enrollment windows through no fault of your own, just because nobody explained them clearly, you can pay higher premiums for the rest of your life, permanently, for a timing mistake. That's the game. Today, we're opting out of it. Let me just explain what these 4 parts actually are. Part A is your hospital insurance. If you end up admitted to a hospital, a skilled nursing facility, hospice care, or need some home health services, Part A is what covers that. Here's the good news. Most people get Part A for free. If you or your spouse worked and paid Medicare taxes for at least 10 years, you don't pay a premium. 0. It's already been paid through your payroll taxes your whole career. But, and this is important, free does not mean unlimited. Part A has a deductible. In 2026, that's around $1,600 per benefit period. Not per year, per hospital stay. If you go to the hospital twice in a year for separate issues, you could hit that deductible twice. Part B is your medical insurance. Doctor visits, outpatient care, preventive services, lab tests, some medical equipment. This is the part that covers you when you're not in the hospital. Part B is not free. In 2026, the standard monthly premium is around $185 per month. That gets deducted directly from your Social Security check. Here's the thing the industry doesn't advertise. If your income is above a certain threshold, you pay more. This is called IRMA, Income-Related Monthly Adjustment Amount. High earners can pay up to 3 times the standard premium. If you're planning early retirement or a big Roth conversion, this is something you need to plan around. Part B also has a deductible. $240 in 2026, and then you pay 20% of Medicare-approved costs after that. That 20% has no cap. That's the gap that Medigap plans are designed to fill. Part B equals doctor visits and outpatient care. Costs about $185 a month. High earners pay more. After the deductible, you still owe 20% of every bill, with no ceiling. Part C, also called Medicare Advantage, is where things get interesting. Medicare Advantage is not a government program. It's private insurance that's been approved to replace original Medicare. Private companies, Humana, United Healthcare, Aetna, offer these plans and get paid by the government to manage your Medicare benefits. On paper, it sounds great. Lower premiums, sometimes $0 per month, vision, dental, hearing. But here's what the TV commercials with the 1-800 number don't tell you. These plans have networks. Your doctor might not be in network. Your hospital might not be in network. And if you get sick in another state, good luck getting covered. Part D covers your prescription drugs. Every Part D plan has what's called a formulary, a list of drugs the plan covers, organized into tiers. Tier 1 drugs are cheapest. Tier 5 drugs can cost hundreds per month, even with coverage. Before you pick a Part D plan, you need to know what medications you take and find a plan whose formulary covers them at a reasonable tier. The Medicare Plan Finder on Medicare.gov lets you enter your prescriptions and compare actual costs. Use it. It takes 20 minutes and can save you thousands. There's also an important penalty here. If you don't sign up for Part D when you're first eligible, and you don't have other creditable drug coverage, you pay a permanent late enrollment penalty. Every month you delay, that penalty grows. Before the plain English verdict, here are the 3 things I want you to remember. 1. Your enrollment timing is more important than your plan choice. Miss your initial enrollment period, and you may pay late penalties for life. Get the timing right first, then pick the plan. 2. Original Medicare has no out-of-pocket maximum. Parts A and B together leave you exposed. That 20% Part B coinsurance has no cap, meaning a serious illness could cost you $50,000 or more in a single year. 3. The cheapest plan today can be the most expensive plan when you're sick. A $0 premium Advantage plan sounds incredible until you need serious care. High copays, narrow networks, and prior authorization can make free cost you more than a $185 a month Medigap supplement would have. Price the plan you'd need when sick, not the plan you'd need when healthy. Okay, plain English verdict time. Here's what Medicare actually is, stripped of every word the industry uses to confuse you. Part A pays your hospital bills. Part B pays your doctor bills. Together they're called Original Medicare, and together they leave a gap, specifically that uncapped 20% on Part B. Part C is a private company offering to bundle and replace A and B, usually with extra perks. Read the fine print before you trust the commercial. Part D covers your prescriptions. Sign up on time or you'll pay a penalty every single month for the rest of your life. That's it. 4 parts. The system isn't complicated. It was just explained to you by people who benefit when you're confused. Now you're not confused. If this helped you, hit subscribe, because this is what we do here. Every week, one more piece of the insurance puzzle, explained like you deserve to have it explained. Drop a comment below. Which part of Medicare was the most confusing before this video? And if you know someone who's approaching 65, send them this video. Next week, we're getting into the enrollment windows, the specific dates and deadlines that, if you miss them, cost you money every month for the rest of your life. Most people find out about these penalties after it's too late. You won't. That video is already up. Links right there. I'll see you in it.